Good morning, everyone, and welcome to year 3 of California's Master Plan for Aging. I'm Susan DeMorris, the director of the California Department of Aging, and we're thrilled to have more than 1,000 people registered this morning. Let us know who you are in the chat so we can say hi to you, and we're going to give it just a moment here while people continue to join. We've got a jam-packed hour ahead of us. So buckle up for the ride, and we're going to go ahead and get started with just a few housekeeping notes. We want to thank our American Sign Language interpreters for joining us and providing interpretation services. We also have closed captioning available via Zoom. All of the slides and the video recording will be posted to the MPA at mpa.aging.ca.gov site under progress and updates. If you want to share it with anyone or go back to the record, we have the chat feature open, as I mentioned. Today, we are not able to take Q&A, and we'll be talking about opportunities for public comment starting as soon as next Tuesday. So with that, we'll go ahead and get started and share with you the purpose of today's convening. We're excited to share with you a large volume of high impact work that's happened over just the past year. Our purpose in convening today is to introduce you to 3 new Master Plan for Aging deliverables, so you can get familiar with the content at your own pace and bring forward your comments, suggestions, and critiques to us starting next Tuesday at the public meeting of the Master Plan for Aging Impact Committee. We understand it takes time to digest so much material all at once. The 3 new Master Plan for Aging deliverables that we're going to be talking about today are: first, we are formally releasing our annual report to the legislature. This captures our 2022 progress and highlights our shared successes. Second, starting today, there are 95 new Master Plan for Aging initiatives across all 5 bold goal areas. These initiatives will be our focus over the next 2 years as we work in close collaboration with the legislature and stakeholders. And the third item we'll be discussing today is an impressive new MPA initiative tracker tool that you'll learn about this morning. As I mentioned, the first opportunity for public comment on these 3 items will be this Tuesday, January 24th, at the Impact Committee meeting. It's scheduled for 1 to 3 p.m., and public comment will be available in the latter part of the meeting. We'll share more details about that with all of you at the close of this morning's webinar. I'm now looking on the screen to see if, yes, our first presenter. It is my honor to introduce California's Health and Human Services Agency Secretary, Dr. Mark Galley, who has been leading the Master Plan for Aging work since before Governor Newsom issued his executive order on June 10th, 2019. Secretary Galley is a force for equity in all policies for all people. He has been instrumental in driving California's comprehensive Health for All agenda, which includes older adults, people with disabilities, and family caregivers. Thank you, Dr. Galley, for joining us this morning, and welcome.
Hey, Susan and everyone. First, thank you for including me in your lineup this morning. It's always a privilege to have a few moments with this really growing, enormous group of stakeholders and advocates and partners in community. Susan, I just want to take a moment and thank you and your team for the tremendous work and leadership that you bring to the state. Your heart and compassion and fierce advocacy is second to none, and I'm just so grateful you're part of the team that I have a privilege to be part of as well. Just it's in some ways pretty incredible, and in other ways hard to believe how far we've come. I have to say, I go to meeting after meeting these days, and I hear about how we had this pre-pandemic plan and now we're just picking it back up, and there was a lot of disruption. But as I reflect on moving into the third year of the master plan, this is one of the few areas that, in my view, picked up steam during the throes of the COVID pandemic. Remember as well, Senator Atkins, when we were together in San Diego before the pandemic to do a roundtable on housing issues facing older Californians. We had a chance to be in your district, and I had the privilege of doing a number of in-person roundtables with Senator Atkins and other legislative leaders to really catapult this forward. And then the pandemic hit, and everyone thought that things like the master plan would just get shelved and we'd have to put them on hold. But I have to say, because of the literally 1,000 people here today with us, that work kept moving. The concept of equity, the issue of how the pandemic affected older Californians in different ways, stayed at the forefront. You were instrumental in so many of the specific work groups, whether it was around isolation and services or the behavioral health pressures around the pandemic, the food insecurity issues, the vaccine and testing challenges. This group was there, and it shows up in the way the master plan moves forward. And if you look just last year at the Day of Action that I had the privilege of being at, and still today, think about some of the things I learned, and Susan knows it, and you ask other department heads, they will tell you, Dr. Galley still remembers when you said this at that meeting, and how that's still pushing us to look at different ways to look at housing, different ways to think about transportation, all of the issues that percolate up in these important meetings. The master plan has had a number of important leaders. One of the most important, obviously, has been our own governor. His commitment to this work shows up every time we have a budget conversation, every time we talk about bills, when we talk about the success of the agency and the department in helping support the thousands of people literally across the state working on this work. It all starts because of his leadership and his commitment to work with Senator Atkins and colleagues in the legislature to make sure that we keep this on the front burner. And in a hard year with a budget, relatively speaking, there's still a lot that's going to keep catapulting us forward. In today's anchor, whether it's the new research initiative or our justice collaborative, and the focus that new things are coming together that allow us to focus on the needs of older Californians and those with disabilities. And when I think about it, many of you know I live in Los Angeles. We often talk about how we're a quarter of the state. When I think about 1 in 4 Californians in 2030 are going to be over the age of 60, that's like the entirety of LA County in California being over 60 and older. That is an enormous point to think about. So the urgency of the work of the master plan is not just because we have some nice to have desires and moves. This is because it's urgent. And I love what we do with the master plan. It's not just about services and supports. Yes, it is about that, but it's also how do we draw in 1 in 4 Californians in 2030 into the work of the state. And we talk about all of government approaches. What I loved about the MPA from the beginning is it wasn't just about all of government. My undersecretary, who's been a force on this work too, Marco Micha, often talks about the all of society. So we're not here to talk about how Susan and other departments and myself and the entire cabinet is coming together. That is true, but it's really about the work we do with so many of you, not just side by side, but with you in that leadership role. So we're really grateful for this opportunity to be here today. And Susan, again, thank you for your leadership and thank you for your commitment to keeping this work moving forward. So without further ado, I really just want to take a moment. Senator Atkins, Pro Tem Atkins, thank you for being here with us. I somehow feel like the spoiled secretary who often gets to be on Zooms or panels with you where I get to hear your take, your flavor, your motivating us to be better and do more. I know this is a core issue for you, your staff. Carry that forward in making sure that we're not just held accountable, but that we're pushing the envelope ourselves. And that visit in San Diego, serving meals first and then sitting around the round table, will stick with me for a long, long time because it was a formative moment for me in this MPA. So with that, thank you for taking some time to talk to the group, and I'll turn it over to you.
Well, thank you so much, Dr. Galley. You have been an incredible partner and always answer the phone during this pandemic. I'm shocked at how much you're able to accomplish and continue to do. I want to add my thanks to Susan for her incredible leadership and to everyone on this call, because if you weren't on the Zoom participating, we wouldn't be successful. I have to say, you know, I am one of that third. I hit 60 last year. As I remind my staff often when they help me put together remarks or thoughts on aging in particular, I remind them that I am part of that group. So I was really excited to be invited to join you today because this issue is very personal to me and becoming more and more personal every single year. Not just because I'm aging, but because, you know, I have people in my life during this pandemic. My spouse Jennifer's grandma Jean, 98 years old, we had to pull out of assisted living, not because of the quality of care or COVID in the facility, but because of the isolation that she felt. And she started to degrade because of the lack of interaction. So, of course, my spouse's parents brought her home to live with us. They're in their late 70s. So I am very much aware of the impact that the services, the critical services, and what's facing our senior population is. Being a caregiver for an aging family member is uniquely challenging. And of course, I've seen it firsthand, as I've said. I've been able to adopt a grandmother of my own. My parents died in their 60s, and they would have not had the strong safety net that we are working so hard to provide had they lived into their 60s without adequate health care, without adequate housing, those critical components that we are working so hard here in California to provide. But I just think our story, when I talk about my story, it's not uncommon. Here in California, as Secretary Galley said, 1 in 5 adults cares for an aging parent or relative. You all know just how fast our state's population is projected to grow, as he stated. And that's why we have to be ready. We can't assume that everyone has the good fortune to have a family member or family to rely on as they age. California has got to be committed to providing that support for everyone. And I'm really proud that my Senate colleagues and I, along with the partners in the Assembly, and our governor and the administration, take that responsibility very seriously. Nothing made me happier than to hear our governor's first State of the State speech, where he talked about the plan for aging, the master plan on aging. And at that time, Senator Hannah Beth Jackson had a bill, and we were thrilled because what it meant that there would be an intentionality, which is proven true with Secretary Galley and his whole department. So flash forward, in 2022, we allocated $186 million to modernize the Older Californians Act. Over the course of 3 years, restoring previously supports that have been cut and services, working with area agencies on aging, and you are God's people for sure, to bolster senior nutrition programs, support for family caregivers, volunteer development programs, age in place programs, critical during COVID. Last year's budget included funding for local jurisdictions to create age-friendly communities to ensure that our older Californians have a safe and reliable place to call home. We've led bold legislation to increase housing production, also helping vulnerable Californians, including our seniors, continue to live at home. One bill that I offered, the California Home Act, grants homeowners options to add rental units on their property, potentially give an older family member the ability to live near loved ones or our younger kids who need to come home. But having a place to live is just one critical piece of the puzzle. We also took action to meet other pressing needs, which all of you are aware of, but I think it's really important to highlight. In 2019, we expanded CalFresh to include 300,000 new SSI and SSP recipients. And since then, we put more money into outreach to make sure that older Californians know it's a resource that is absolutely available to them. We've provided first ever operating subsidies for assisted living facilities that care for adults who are on SSI in order to protect those living options. We've bolstered community-based adult service programs, the multi-service senior program, as well as the caregiver resource centers. So over the past 5 years, we've supported and encouraged the growth of local aging and disability resource connection programs, which gives seniors a single point of contact and connection to help navigate the complex web of services that we're trying to provide to serve everyone. So we still have a ways to go. And we want to make this statewide, and we're working hard towards it. And as Secretary Galley said, even in light of budget actions, we have still implementation and resources to put towards this. So I have to acknowledge and thank my former colleague, Dr. Pan, who helped establish the Office of the Long-Term Care Patient Representative. And we are expanding the California Food Assistance Program and Medi-Cal eligibility to undocumented seniors who contribute to our economy. So those are just some of the Senate-led accomplishments, most of which were able to successfully be implemented during the pandemic, as Dr. Galley pointed out. Throughout the last few years, we saw serious toll, as I stated, about my own life experience with isolation and what it has had the impact on all of us, but especially the most vulnerable. So, we can never get the birthdays and the holidays back that we missed during the pandemic. But as we move forward, I think the pandemic's impact on our older Californians, people with disabilities, caregivers, is a stark reminder that the work that you're doing to the staff at Cal HHS, our Department of Aging, and that our local partners like my own in San Diego, serving seniors and elder help, that the work you're doing is critical. It's life affirming, it's life saving, and it's a lifeline. So whether we're addressing the challenges of housing or healthcare, or working to ensure our seniors can meaningfully engage in their communities and maintain their independence, California is leading the nation. And we're going to continue to do that on how we treat and take care of our aging population. I'm really proud to be part of this change and to work with Secretary Galley, HHS, the Department of Aging, the governor, my colleagues in the legislature, and all of you. So our work has just really begun. I look forward to continuing to work with you to make this a reality so that all of our golden years can be brighter and better for those who call the Golden State home. But I do want to acknowledge my staff. Mariva Brown is on. She continually keeps me posted and up to date. Jason White's in my district office. Intentionality and focus. And I am so proud to be part of a team that does that. I know that we have a new person on today. So thrilled to see Dr. Jasmeet Baines in the Assembly, and her leadership is going to help us as we move forward. And again, I took up way too much time, but this is so exciting and so important. And I just want to end where I started with my incredible thanks to all of you.
Just to thank you so much, Pro Tem, for taking some time. A lot of, as I expected, a lot of motivation coming in, a lot of really important reminders and points about where we started, what we've done, and where we're going to go. So just thank you for taking some time to join us this morning. Susan, I think we turn it back to you now, yes?
That is correct. Thank you, Secretary Galley, and thank you so much, Senator Atkins, for your exemplary leadership and for touching on your own life experience that's shared by so many on this call, including lots of people in the chat from your district who are saying hello to you. You may not see that. It's now my privilege to introduce all of you to a new leader in the aging space. We are delighted to welcome this morning the chair of the Assembly Aging and Long-Term Care Committee, appointed by Assembly Speaker Rendon. We welcome from Kern County, Assemblymember Baines, Dr. Assemblymember Baines. Welcome and thank you for joining us this morning.
Good morning. Can everyone hear me okay? Awesome. It is an amazing morning right here in Kern County. I'm currently at my district office. I want to thank Senator Atkins and Secretary Mark Galley for their remarks, and most importantly for their attention to a very, very important topic, and that is how do we properly take care of our seniors, our growing population in California. In about 1 to 2 years, we will have 1 out of 4 people over the age of 60. This is a top priority. I am definitely very grateful for this opportunity to bring my skill set as a physician. I am the first physician to be in this position as chair of the Aging and Long-Term Care Committee, which is really exciting because I get to bring my experiences from taking care of my patients, but at the same time, my personal experiences of taking care of my grandmother at the end of her life. I was her primary caregiver for 2 years as she suffered from idiopathic pulmonary fibrosis. And at that same time, I was completing my residency, coming home, taking care of grandma, having to deal with being a primary caregiver, working full time. What do we do as a state to make sure that our people that are taking care of their loved ones have all the resources they need to properly take care of their loved ones? I'm very proud to be the first Sikh American, first South Asian woman in the California legislature. And with that, I bring my culture of taking care of our loved ones. In the Punjabi culture, we are always taught to take care of loved ones and make sure that you do all you can. And this is not just in the Punjabi culture, it is in very many cultures across. What do we do to integrate our culture responsibility at the same time, take care of our seniors, and at the same time, complete our responsibilities to our families? I'm very excited for this opportunity. As a doctor on the front lines of COVID, I have seen a lot of problems within the healthcare system. Working here in Kern County as a family medicine physician, taking care of our seniors, working in skilled nursing facilities, working also in long-term care. There is a lot of work that we can do together, specifically for our population with developmental intellectual disabilities, our growing population, and at the same time, our vulnerable populations. If you want to know what will impact the state in 5 years, I often say, look to Kern County today. All of the data and projections that are playing out in real time right now in my district is what the state of California will see. I'm really excited to be from Kern County. I'm really excited to be the new Assemblywoman for 8035. I'm excited to get to work to make sure places like the district that I represent, which has some of the highest poverty, some of the highest illiteracy, and some of the highest lack of access to resources. And I'm very proud to have this position as chair to really put a lens of focus on my district, but all of California together to make sure we strengthen resources for our seniors and make sure they have everything that they need and deserve. So, thank you so much.
Thank you so much, Assemblymember Baines, and it was an honor to meet with you. You're already meeting with key constituencies and stakeholders, I know, and we look forward to working with you. And we're so excited today to unveil the new initiatives that we'll be working hand in hand with your committee on. I now, we're going to move backwards with our slides. We wanted to acknowledge some key partners in this work. First, we want to thank the foundation partners that were the impetus for the Master Plan for Aging and funded the initial work and continue to fund and support the work across government in public-private partnership. So thank you to all of our foundation partners for your continued commitment and investments in the Master Plan for Aging. Next, I want to thank all of our stakeholder committees on the next slide. This work would not be possible without the 7 stakeholder committees that meet regularly. We have over 250 Californians from every part of our state who meet regularly. to advise the administration on these very important topics. So thank you all for your leadership and your commitment of your time. And our membership in these committees. So keep an eye to them as we recruit new members in the coming year to continue the work. And now we can get back to our program. It's absolutely a delight to welcome a very familiar face to this group, Kim McCoy-Wade, who led the Department of Aging through the development of the Master Plan for Aging, the launch of the Master Plan for Aging, and now in her key leadership role as Senior Advisor to Governor Newsom on Aging, Disability, and Alzheimer's, continues the work from the Governor's office with the entire cabinet. Welcome back, Kim.
Oh, thank you, Susan. It is wonderful to be with the family of aging, disability, caregiver, the community growing in California, and just thinking back to our goal to grow the community, grow our leadership, diversify our leadership, and we're seeing that here today. I have the enormous privilege of talking about California's commitment. Many people have already talked about back in 2018, thanks to philanthropy and stakeholders, we had gubernatorial candidates who pledged to do a master plan for aging. And as we've already heard, Governor Newsom, upon his first election, continued that pledge with the State of the States in January, and then an executive order in the summer. And as Secretary Galley said, informed by the pandemic, while responding to the pandemic, we kept that work going. And 2 years ago, delivered the Master Plan for Aging with both that 10-year bold goal, 10 years of 5 bold goals, as well as specific initiatives. So I'm really pleased to say here we are at the dawn of a second term of Governor Newsom, the Governor Newsom's administration. And as he says in his opening message, we are both aspirational and pragmatic. We reaffirm those 5 bold goals for 2030, when 1 in 4 Californians will be 60 or over. And again, importantly, have one of the longest lifespans anywhere in the country. We heard that from Senator Atkins, with 3 generations over 60. It's both that many of us will be over 60 and that we'll be living longer into our 80s, 90s, and 100s. But we're also assigning ourselves a pragmatic list of things to do, a to-do list. And those are the 95 new initiatives you'll see shortly. So again, aspirational and pragmatic. Next slide, please. None of this could be possible without these 14 faces as well. And this is our cabinet work group on aging. And I'm going to take a second, not to say their names because they're a humble group of people, but to say their agencies, to show how that M is not just for Master Plan for Aging, but really is multi-sector. It really is an all of society, all of government. So starting in the left, we have corrections and rehabilitation. I'll refrain myself from commenting on every single one, but just to list them: corrections and rehabilitation, natural resources, food and agriculture, Veterans Affairs, of course, Health and Human Services with Secretary Mark Galley. On the next row, we have our nation-leading volunteer programs, our labor and workforce, our emergency services, government operations, environmental protection, planning and research, government business, consumer services, civil rights and housing, and transportation. These 14 agencies and departments and offices have made these 95 commitments to continue to advance a California for all ages and abilities by 2030. Next slide. When Susan and Marco and Mark and I were thinking back and reflecting about all the accomplishments, you're going to see a long report with lots of accomplishments, but really what rises for me are 2 things that I think we can all take pride in. The first one is the investments. And the investments are important not just because they were long overdue and because the word is billions, not millions, and not single billion. There's a billions, billions in services for older disabled adults and families. But what's really important is that we're building a system of home and community care. California has been a leader in systems. Historically, our higher education system, second to none. But in the last few years under Governor Brown and Governor Newsom, really investing in our K-12 system, our early childhood system, and with Mark Galley's leadership, our behavioral health system. And now we're doing the same for our older adults and disabled adults and families, creating a home and community care system. What does this mean? We look back to our stakeholder report from March 2020, who said, this is the top priority. This is the committee that was named in the executive order. This is the issue that was named in the executive order. And here's what we want to see. We want to see services, and that's where you have unprecedented investments, from a few hours of home care and some home delivered meals, all the way through more intensive community care at day centers, to more housing with services built in, to the skilled nursing end of the continuum. We want to see services all along that continuum. Services need navigation so families can find them and coordinate those services. We need workers, well compensated, well supported, respected workers. We need to be able to afford it, a continuing challenge and priority in California. We've made progress on the lowest income and more to do on the middle income. And of course, we need continued state leadership with dashboards and planning and roadmaps to pull it all together. And that is where we really have had major progress these last 2 years, laying that foundation, all departments, all agencies, federal partners, providers, to have a system. The other thing that was, just to add on that, I should say, the other thing that I'm calling to my mind is the work of all those stakeholders, says that as you build this system, don't forget, families are at the center. Families of choice, families of origin, families are at the center. Equity must be embedded, and dementia awareness must be woven through. And those are the things that I remember from all those meetings that we carry forward with all these investments as we build a system of care as we age. Okay, next slide. The second takeaway that I think we can all be very proud of is inclusion. We have really worked together to say, whatever the state's priorities are, or the economic priorities or social priorities, how are we including all ages and all abilities? And I'll just take a second and lift up some of the ones. And again, we've already heard them already, but let me just say, housing. Housing, you heard about the incredible acceleration of what used to be called granny flats, but the accessory dwelling units that allow us to live intergenerationally, live with caregivers, build fully accessible housing, that type of intergenerational planning. Or under Kim Johnson's leadership at Department of Social Services, the continuing care expansion, have housing with services, 6 beds, residential living with services, building to meet the need there. So housing is increasingly always a top priority, increasingly including older and disabled adults. I don't have to say much about emergency preparedness after the last couple of weeks we've had and response, but whether it's a flood or a fire or heat or power or an earthquake, increasingly older and disabled adults living at home or in the community are centered in our response. You saw it in COVID, and you see it continuing to elevate as a priority population, thanks to the leadership of Cal OES and Cal HHS. Volunteers, if you missed it this week, California put out the RFP for our new Experience Corps, our version of an AmeriCorps for older adults who want to volunteer with kids in need or with peers. So if you want to run an Experience Corps program, check it out at Cal Vols. But adding to our College Corps, California will still soon have an Experience Corps. Transportation, unprecedented infrastructure money coming down from the feds, and our leadership is putting it into accessible public transit for all ages and abilities, putting it into safe streets so that we can all walk and move and have mobility in our communities safely. And last but not least, I could not mention all the work on family leave, led in part by our terrific first partner, Jennifer Siebel Newsom. Family leave, many people think of as new babies. It is that, and it's also caring for our spouses and our loved ones, our parents as they age. And this year, California extended it to families of choice. Very important for those of us as we age who may or may not have spouses or biological relatives who we are giving and receiving care from. So again, California leading. So with that, next step, next slide, please. The next step indeed is California living up to the governor's maxim that the future happens here. You know California for our climate leadership. You know California for technology. You may know California for gay, lesbian, transgender rights, but now you should know California for aging as well. Look at this wave across the country, across the regions, across the politics. that multi-sector plans for aging are spreading. We were not the first. We learned a lot and continue to learn a lot from our peer states, Washington, New York, Minnesota, Colorado, Massachusetts. Thank you to those 5. And we continue to elevate and lead together. And who knows, we hope to see a national multi-sector plan for aging someday as the nation goes where California is going now. So with that, we have much to be proud of today, much to celebrate. But as every speaker has said, much work remains. We are committed to deliver the results. We are committed to build towards 2030. And there could be no better person to lead that work than our Director of the Department of Aging, Susan Damaris, who I will hand it back to now. Thank you, Susan. Thank you, everybody.
Thank you, Kim. And it's just incredible to witness today. I know we're just skimming the surface of all of the achievements that have happened in the last year, the last 2 years, and you and everyone on this call deserves tremendous credit for where we are today. I'm now going to walk you all through just a little bit about, why we're here today, the new documents that we're sharing with all of you. So that when you review them in your own time, at your own pace, that you're familiar with the frame that we're working with in the coming year. So we'll go ahead and move to the next slide. All of the new initiatives, the 95 new initiatives that we're focused on today and for the next 2 years, they all emanated from extensive stakeholder input. This includes our 7 stakeholder committees, the Commission on Aging, our close collaboration and consultation with legislators, legislative staff, budget staff, working in concert across government, including our federal partners, our state agencies and departments and offices, and our county partners. And that stakeholder work culminated on September 20th, when we held the Cal for All Ages and Abilities Day of Action, and we heard directly from our stakeholders about what was important to focus on in the coming year. And I hope that you will see reflected in the new 95 initiatives, what you heard on that day and what you've been hearing at the stakeholder committee level. We'll go ahead and move to the next slide. We heard very soon after last spring from our impact committee, which is our oversight and accountability committee, that they needed help focusing. And we've heard that from many, when there's such a huge volume of work and such a high impact, how do we focus? So, one thing that we did, and it might not be noticeable, but we did reduce the number of initiatives by about 1/4 from 132 in the first 2 years to 95. This is an attempt to focus and to move us closer to what you heard Kim McCoy-Wade say in terms of getting to a system of care. We now have 95 initiatives, and each of them a designation: deliver, analyze, or communicate. This is a way to help you and to help us focus on these initiatives and to help us stage this work over the next 2 years. What is different in year 3 from year 1 is we get to deliver on initiatives that were launched by the administration and the legislature with, as you heard, billions of dollars of investments in state general fund, federal dollars, federal home and community-based services dollars. So this is a wonderful new dilemma that we have, is how do we deliver on all of the initiatives that have come about because of the Master Plan for Aging. So you'll see throughout the initiatives whether the priority is to deliver, to analyze, as you heard from Senator Atkins, that our work is not done. We are still analyzing and assessing many of our programs. We're looking at our state's geography. There's quite a bit of analytical and feasibility work that still needs to happen to design and develop that system of care. And then so much of it is communicating. How do we convey this information to individuals who need it, to families, to communities, to counties, to regions? to organizations. So you'll see these 3 tags throughout the initiative document. We'll go ahead and move to the next slide. So similar to the first 2 years, each initiative is centered on one of the 5 bold goals. The 5 bold goals remain unchanged. All of the initiatives underpin the 5 bold goals. Also, our 23 strategies remain the same. So those have not changed, and you'll see those reflected throughout the initiatives document. So these 95 new initiatives support the 5 bold goals, and we encourage you to spend some time going through each of them and all of them. And we welcome your feedback, your input, your comments, your critiques. We are receptive to input, whether that's an email, a formal letter from you or your organization, or what I think is one of the best ways, through the stakeholder committee process, to weigh in during the public comment period. All of our stakeholder committees dedicate time to public comment. Next slide. It is now my pleasure to introduce another familiar face to all of you. Sarah Steenhausen was a key advocate and driver of the master plan work in her former role with the SCAN Foundation. We're thrilled that as of this week, she's been with the California Department of Aging for 1 full year, serving as our Deputy Director over the Division of Policy, Research, and Equity. Sarah, welcome. Take it away.
So much. Thank you so much, Susan. What an honor it is to be here today and to be here with all of you and to see just the incredible audience that we have with us today. And I just want to really emphasize something that Susan talked about, that as we developed these new initiatives, they really were informed by our stakeholders. These 6 stakeholder advisory committees that really help frame our work in the master plan for aging. They work all year long. They meet 3 to 4 times a year as a full committee. And then they have work groups in between. It's a lot of work and a lot of time on their part. And of course, this all culminated last year when we held the Day of Action in September. So we were able to take a lot of the input in the work that was developed over the past few years by these stakeholder advisory committees and think about how it can inform the next iteration of initiatives in the master plan for aging. So I hope that you do see where your voice is reflected in this work. I'm going to highlight a few key elements of that, but before I do that, I also want to note that it's not as if we have just forgotten the first 2 years of initiatives that were developed. We have built many of those into the new initiatives, and you can find the updates on what happened with all of the first 2 years of initiatives in our new implementation tracker. And Amanda Lawrence, our project director of the Master Plan for Aging, will be walking through that very carefully. So again, I just want to thank you all, and we really take seriously the value of listening. And it's because of listening that we have been able to advance our work together. So in the next slide, what I want to do is Susan provided you with a very broad overview of how we structured the new initiatives across the 5 bold goals. But what this slide is I'm just pulling out a very just 7 of the key initiatives that we feel really reflect what we were hearing all this past year and in the Day of Action. This is not to say these are the ones that we're focusing on, and all 95 of them are critical, but we wanted to just pull out a few of them because they really resonate with a lot of what we heard at the Day of Action. So for example, under Initiative 2, this really focuses on the tremendous need to develop housing alternatives and options, affordable, accessible housing for older adults and people with disabilities. We have heard loud and clear from the community that many older adults and people with disabilities are renters. And so we really need to look at some of the emerging local government models to inform our consideration of a rental subsidy program. We see some really exciting efforts happening at the local level, and we are really committed to continuing to explore our work in this area. The second, initiative number 9, I want to thank and call out the work of our transportation subcommittee of the Disability and Aging Community Living Advisory Committee. They've done a tremendous job of really focusing on the need for more integrated, accessible transportation models. So we are going to be focusing on supporting the expansion of this, including considering how we might strengthen the consolidated transportation service agencies at the local level. Third, I wanted to focus on the issue of long-term care financing. You'll see in Initiative 18, we are doubling down on our commitment to continue evaluating options for developing a universal LTSS benefit. This is so critical to the millions of Californians that struggle every year to pay for their long-term services and supports. Fourth, you'll see in Initiative 31, we heard loud and clear from our partners at the California Commission on Aging and many others about the need to really strengthen our older adult behavioral health services to ensure that all older adults can access behavioral health when they need it and in accordance to wherever they are across the state. So we are really excited to be partnering with the Mental Health Services Oversight and Accountability Commission to expand access to evidence-based behavioral health programs. And we hope that this is just the beginning to building out and bolstering our behavioral health system for older adults. Fifth, we have heard very clearly, our Alzheimer's and Related Disorders Advisory Committee has been such a strong advocate for the needs of people with Alzheimer's and their families. So we are really committed to replicating best practices that have been developed as part of our California's Healthy Brain Initiative and the Blue Zone efforts. Six, in the area of the Aging and Disability Resource Connections, California is really excited to be expanding its work to develop a no wrong door system. And as part of the development of a no wrong door system, Aging and Disability Resource Connections are critical to that. So over the next 2 years, we're really focused on promoting the sustainability of this service delivery model at the local level, bridging aging and disability, and ensuring that people can have access to the information they need to make informed choices for their long-term services and supports. And finally, but certainly not least of importance, is focusing in on the needs of our family caregivers, our family or friend caregivers, who really are the backbone of our long-term services and support system. We're really excited to be committed to developing a statewide caregiver equity roadmap and strategy to ensure that we are providing access to the services that these family and friend caregivers need to provide support to their loved ones as they age. So I'm really pleased to provide that overview. And at this point, I'm super happy to be able to introduce Amanda Lawrence, who is Project Director of the Master Plan for Aging. Amanda has done an incredible job of really developing all of the different elements of our master plan and working across departments and agencies to keep the work moving. She's going to talk to us a bit now about the issue of accountability and how we can ensure that as we move this plan forward, we are held accountable for this work and this progress. So Amanda, take it away.
Right. Good morning, everyone. Thanks, Sarah. We've said time and time again, the Master Plan for Aging is a blueprint for action. And so we have created several layers of accountability to hold ourselves true to that commitment. So I'm going to review 3 of those accountability measures with you this morning. On the next slide, you'll see our first measure of accountability. So when we launched the master plan, we called for the creation of a stakeholder advisory body to provide oversight and guidance to the administration on MPA implementation. We are so grateful to these 9 members who serve on the Impact Stakeholder Committee. They have served for the past 2 years representing organizations leading in aging and disability and equity locally, across the state, and nationally. And they have all been partners in this work, and we look forward to the continued collaboration with the Impact Stakeholder Committee. On the next slide, you'll see our next layer of accountability, our data dashboard for aging. And we launched this 2 years ago in partnership with West Health Institute and the California Department of Public Health. And we've continued to expand upon and improve upon the indicators and measures that are available in this data dashboard for aging. We've added publicly available information for both state and local planning across all 5 of the MPA's bold goals across all of the strategies. This year, we've added several new and updated data sets, and priorities for this coming year include adding new indicators on topics such as falls, health insurance, homelessness, retirement security, and older adult participation in the workforce, as well as updating existing indicators as more data become available. On the next slide, you'll see our newest layer of accountability, our MPA implementation tracker. Jackie will go ahead and put a link into this into the chat. We are excited to unveil this new publicly available tool. It is a database essentially, and it allows our users to search for MPA implementation initiative updates by goal, strategy, topic, and more. We developed this tracker in partnership with the West Health Institute, who has just an absolutely fabulous team who has been supportive of the MPA from the beginning. On the next slide, you'll get to see a screenshot of what this tracker looks like. You can see that you're able to search by a number of different fields. We actually have added more since I took this screenshot. So you're able to, again, search by agency or department, or maybe by the topic. We've tagged all of the updates. You're also able to go ahead and download your search results. So you might want to search for the California Department of Aging. It would pull up all of the updates we've provided for all of the first 2 years initiatives, and you can go ahead and download that. You can also find all of the new initiatives in this tracker. Of course, there aren't any updates yet, but they are available to be searched and seen. And then on the next slide, I just wanted to remind everyone that we continue to offer the Master Plan for Aging local playbook. We also offer this, with the data dashboard for aging as a tool to assist with local and statewide planning. We also want to ensure disability integration and equity integration into the local playbook. So we are going to be giving it a refresh this year. We will be sure to include new resources. You can always send any resources you recommend our way. We'll consider including them into the playbook. It's available on our MPA website. You can also download a PDF version. But we really look forward to making sure that this tool has the most up-to-date lessons learned, best practices, and resources for the communities across the state who are doing age and disability friendly planning. We recently conducted a survey across all the counties in California, and almost all counties are actually involved in pretty rigorous age and disability friendly planning at their local level. And almost all of them mentioned that they have been referencing or using the playbook in their planning activities and efforts. So very happy to hear that. So I'm especially pleased to share with you that we are launching a new grant program. The next slide has an overview of what we're going to be offering. We have $4.5 million to provide competitive grants to support local communities in developing age and disability friendly action plans. We are going to be releasing this request for applications in about a month, so mid-February. We anticipate that we would review and execute contracts by around June or July when the work can get started. So if you are interested in applying for a local planning grant, the link is in the chat, or just head on over to the Master Plan for Aging's website and you can find more information there. Thank you very much. I am going to go ahead and pass it back over to Susan for closing remarks.
Thank you, Amanda. And we can't wait to see these applications come in for the local planning grants. This is a miracle, all of this high volume, high impact work. And, the greatest miracle is that we're running pretty close to on schedule and trying to cover all of this with you in 1 hour. I want to close by congratulating every single person on this webinar. Each of you has contributed in your own way to the success of the master plan to date. Work like this does not belong to any single agency, department, organization, committee, commission, or foundation. It is a collective response. And in my view, we're successful because of the depth and breadth and diversity of our community. I want to just make a special note of thanks to two of my colleagues, Nancy Bargeman, who leads the Department of Developmental Services, and Joe Xavier, who leads the Department of Rehabilitation. Nancy and Joe have been phenomenal partners as we try to bridge aging and disability. And I want to thank them and their teams for all that they've done to support the Master Plan for Aging. And I continue to look forward to working with both of them, as well as the other directors in the Cal HHS agency and the agencies across the Newsom administration to further this work and the 5 bold goals. I invite each of you, as you review the extensive materials that we're sharing with you today, to renew your commitment in some small way. This could be as simple as owning one initiative or one goal area, but please recommit to this work. It's so important that this report not become stale, not sit on the shelf, and that no one in California thinks that the work is done. We're truly just beginning as we start year 3 of the Master Plan for Aging. This is a 10-year blueprint for our state, and we need every single one of you to stay with us over the next 2 years. In the next slide, and the reason we need you to stay with us is not to further the initiatives and not to gain national attention, but for the benefit and support of older adults, people with disabilities, and family caregivers. That's why we're doing this work, and we need every one of you to continue it. So in closing, the work continues starting today. If you don't yet know it, this afternoon from 1 to 3, in partnership with our key partners, the Department of Healthcare Services, overseeing the transformational CalAIM initiative, a leader in the nation on social determinants of health in our Medi-Cal program, a leader in Medicare integration and innovation. We are partnering this afternoon from 1 to 3 on the home and community-based services gap analysis and roadmap. We're kicking that off today. You'll find that as initiative number 19 in the initiatives shared with you this morning. And as I've mentioned several times, next week, the Impact Stakeholder Committee will be meeting to assess the annual report and the new initiatives, and there will be public comment available at that meeting. Please visit the California Department of Aging homepage for additional information. And if you're not yet signed up for our Engage, I think on the next slide, there's a way for all of you. If you're on this webinar, you're likely getting updates, but if you're not, please let us know. We want to make sure that you don't miss anything, including, we hope, by the end of this month, a major announcement about the CalGrow's direct care workforce funding. Again, millions and millions of dollars flowing to the workforce at the very end of this month or early February. So stay tuned for that. Thank you again for all joining. And most importantly, thank you to the California Department of Aging staff for producing this webinar and doing the phenomenal work that you all are seeing today. I couldn't be more proud of the CDA team. Thank you all and have a great Friday.